It takes a special person to be an EMT paramedic. Get to learn a lot about people. Every time I teach a class, I always make sure they're doing better than me and they know more than me by the time they get their certifications so they'll be successful in the fields. They want to do the job and they're here for a reason. I'm gonna give them the training's worth. I'm always learning something new, even for my students. I think I'll make it a better human being, to be honest with you. If you're just able to see people in their worst and be able to help them in the moment of need and realize that, hey, we should be helping each other out. I think we'll make the world a better place, actually, if we all did something like that. My name is Edward Perez. I've been in EMS since 2003. I started off as a junior EMT firefighter out in Suffolk County. Went to paramedic school in 2007, and that's when I got to the New York City 911 system with Transcat at the time, in the South Bronx, Harlem, and Brooklyn. Then I went to FD1 EMS 2011. Then I transferred to firefighter, which I currently am right now. I'm currently a full-time fireman for the New York City Fire Department. You're not going to be rich. It's not about the money. You got to do this because you care about your fellow human being, your fellow man, woman. You feel like it's the right thing to do. It takes a special person to be an EMT paramedic. My favorite part is to get to meet new people from different walks of life. I don't know everything. I've been in EMS for about going about 20 years now, and I'm always learning something new every day. And each student I come across with different backgrounds, I learn something new from them to be a better instructor and to be a better pre-hospital provider as well. So I'm always learning something new, even for my students. Just like everybody else, September 11th was 14 years old. I felt useless, hopeless, and I realized that, hey, I want to do something with my life where I don't feel completely helpless and I'll be able to help my fellow man and help people. Still doing it to this day. Be cool, calm, collect. Take a deep breath in through your nose, out through your mouth. And also assess. So pretty much before you think you're overwhelmed, just make an assessment. What's going on? How can I deal with this? What can I do to deal with this right now? And just like had that little checklist. And as soon as you check off the checklist, that probably seems that was overwhelming becomes very small and minimal. That's the best way I do explain it. And also, don't be afraid to ask for advice and ask for help. I say do it. Why not? It takes a special person to do it, but if you're unsure what you want, it's perfectly fine to give it a shot. And I think it should be a prerequisite, to be honest with you. Get to learn a lot about people and learn about life. And I just think I'll make it a better human being, to be honest with you. If you're just able to see people in their worst and be able to help them in the moment of need and realize that, hey, we should be helping each other out. I think it'll make the world a better place, actually, if we all did something like that. You look at your regional protocols, be proactive, look at the latest medical articles, medicine journals, and look at other sources. What I currently do, I sign for learning platforms on websites to take continuous CMEs to be up to date of the current practices and medication that's currently in trial, and better assessments because just medicine is constantly evolving. So it's really important, tremendously important to keep up to date. When it comes to education, just because you know one thing doesn't mean you know it all. So just have an open mindset. Being a New York City firefighter and being in Special Operations Command for HazMat 1, that's my biggest accomplishment. That's the hardest thing I ever had to do. You know, going from EMS, going to firefighting, it's the same, but that it's not. So EMS pre-hospital setting, do BSI scene safety, and then make sure the scene is safe, and then you go help your patients. Firefighter, you're the first person there when the scene is going chaotic, and just being able to integrate my pre-hospital setting to the firefighter setting. So I'm passionate, I care, I'm hard on them, I hold every student to a certain standard. If you're learning something new, I'm not going to pull that drill instructor move on you. I'm going to help you achieve learn that objective, learn that specific skill. And let's say like months down the line, like a few weeks later, you should have been practicing it. And then it's time for you to become an EMT, or we're about to take the final exam, and a week later you're going to be on the street. That's not okay. So they know that I'm fully vested in them being successful in their career. And I want them to do better than me. So every time I teach a class, I always make sure they're doing better than me and they know more than me by the time they get their certifications, so they'll be successful in the field. It's about them. They want to do the job and they're here for a reason. I'm going to give them the training's worth. What I encourage them not to do is talk down to other students when they get their EMT or paramedic certification, and also to start developing bad habits. Just because a senior provider is doing something and you're questioning it doesn't mean it's the right thing to do. I advise them to don't forget where they came from, don't develop bad habits, and always do right for your patients. You'll find out after you graduate, after you come into this program, and then when you graduate that certificate in hands, then we'll talk about that. The future of EMS is imminent, as in like it's progressing fast now. From when I first became EMT, like in 2005 till now, it's evolving pretty in a good way. So we're carrying more medication, we're having more diagnostic equipment, and also it's not just pre-hospital care going from point A to point B. EMS, EMT, paramedics, they're being integrated in different settings and different jobs. What I mean by that, so you're going to have your law enforcement positions, you're going to have your also federal agencies, they will also require paramedics. You're going to have an office of emergency management, have a paramedic background will help. Paramedicine is evolved for multiple disciplines, medicine, technology, and what we're doing here at BMCC. I've been following Megan for a long time, and everywhere she's gone, she's made every program successful. And her leadership here, and all the other instructors, not just Megan, all the other instructors, we're gonna be the premier college for EMS. Everybody's got different backgrounds. Instructors got different backgrounds. We got instructors that are rescue paramedics. We got instructors that are police officers. We have instructors that are combat medics in the Army. You got HazMat fire. We got firefighters. It's like we're very unique and we can answer any questions, and we have different styles and methods. Students will enjoy the learning and feel confident when they get out there in the field. Anybody could get a certification, right? But having a degree, especially in paramedicine, will be advantageous for you, not only as a provider on the field, but could help you later on in management. It could be in the hospital, office of emergency management, or a job that pertains to pre-hospital care providers. I believe that it's like if you're very passionate about this field, you have more insight knowledge about the field and also what goes on in the background. So I think it'll be very advantageous if there was a bachelor's degree in paramedicine. Be humble. You're gonna make mistakes. Own up to your mistakes. Just be like, oh, I give this medication. No, it's because don't argue with the doctor. Ask for clarification. And if your clarification, you go through the protocols and just like as soon as you find out that you're wrong, admit it, learn from it, keep pushing forward. That's it, because that's how you're gonna grow. Do the right thing for your patient. Put yourself in the patient's shoes and their family members. Compassion will go a long way. And also when to know when to ask for help. We deal with a lot on this job. So we're dealing with people's on the worst day of their life. They usually don't call an EMT paramedic saying, "Hi, how you doing? You know what? I feel like going for a walk. I just want to." They're not there to talk to somebody. They're there it's because they're having the worst day. It can take a toll on the provider. I would say be a people person. Learn psychology a little bit. Learn how to talk to people. Take some classes. I think that's a skill set that can set somebody apart. So it's like know how to deal with people and also getting your experience. Being an MT paramedic, it helped me be a better person. It helped me understand people a lot more than I did before when I was in high school. Being cool under pressure, making better assessments at life, trying not to stress the small stuff. It's easier said than done. I'm a hypocrite sometimes. I'm like, but wait a second, take a step back. So it made me a better person. Being an instructor, you see my students, my previous students in the past like close to 20 years, strive and do better than me. I got students that are doctors, jet fighter pilots in the Navy. Knowing that I helped along their journey, their path, that's very rewarding. That's my biggest accomplishment. And keep doing it until I can't do it anymore. I want the students, how I taught them, I want to pass it on. Pass on the torch. Wow, this guy was an instructor and he was my instructor. He knew what he was talking about and he actually helped me along. I want to be just like that and hold students to a higher standard when I start teaching. So that's a whole legacy I'm hoping.